Welcome to Catalyst for Healing. I am Maria Lloyd, a licensed marriage and family therapist, and today we are going to talk about how to find the right therapist, coach, or other provider for your mental health. So I get this question a lot, people asking me like, how do I know if it's the right person or what should I be looking for? And I think there's a couple things that you want to do when you're thinking about seeking out help. The first thing you want to think about is what are the issues that you're dealing with? Are you able to quantify, are there anxiety symptoms? Are there depression symptoms? What are some of the precipitating factors coming in terms of stressors in your life? What do you notice has been activating and making this situation worse? And you want to get really clear about what you're dealing with first. And then you want to ask, what is your hope at the end of my time working together with whatever provider I choose? What is your hope to accomplish, but also what type of person do I want to be at the end of that treatment? And I think asking those questions is going to help you provide a guide map of who you want to work with. And one of the things that I've been doing with this podcast is trying to educate about the different types of treatments available because we have so many modalities as therapists. There's so many coaches now working with mental health. We've got so many treatment options with regards to medication or now ketamine and psychedelics. And so I think once you get clear on what are the symptoms, what is it that you want, what do you want to accomplish, then it makes it easier to know who to be looking for. And I also want to say, just right off the bat, that the modalities matter. I mean, they do matter, but it's more about the fit of the provider. So, as a therapist myself, I can tell you, and I've worked with a lot of therapists as a client, and I've worked with coaches that that person can only take you as far as they've gone themselves. We're all human beings, we all have limitations. And so, you really want to look for someone that has the experience, and sometimes the life experience really matters. Like I tell people, if they're a couple working on their relationship, it might be helpful to work with someone who's been married or is married. These young people right out of grad school are wonderful theoretically, but they're not going to understand the complexity of how it feels to be in a marriage and be able to address that in a way that might be more helpful to you. The same thing with kids. Like if you're having issues with your kids, again, it's going to be great psychoeducationally to get information from a younger person in the field, but it's so much more helpful to have someone who's been through parenting, who knows kind of the ins and outs of that experience to give you the guidance and support that you need. So with our field, age kind of does matter. And I know in other fields it's a detriment because we don't have the technology down in the same way, but in this field, the life experience can matter a lot. It also matters in terms of just the types of personality or way that people interact might be a fit or might not be a fit. There might be someone who's super directive and that's not your style. It doesn't really work well for you. So it's probably not the best fit for you. So you kind of want to know what type of person do you need? The most critical thing is to think of, do I feel safe? Do I feel comfortable? Do I feel like this person can help me? Those are the three questions that are going to help you find the right person. So I tell people, schedule interviews because all therapists, all coaches, they do these 15 to 20-minute brief interviews to see if it's a good match to work together because most people know it's the same on their end. They're going to do a better job if it's the right fit client. And what I mean by that is they might know how to work with a certain type of person way better than they would a different type of person. And that's why we all have different specialties, different types of techniques that we use. So it's really, really critical to vet. Don't just jump in because one person gave you a referral, because that person might work for them really well. It might not work for you really well. So if you don't have, this is the hard thing with therapists, is often, our friends don't want to share therapists with you. So you're kind of stuck searching on your own, which is totally fine. The best location to search is called Psychology Today. They have the biggest network of therapists. Majority of therapists are on it. And what you can do, and maybe you're learning from my podcast, I really want to try this modality. So they actually have the ability to put in your insurance, also to put in your location, you put in your zip code, and the types of modalities and types of issues that you're working with. And it will bring up the profile of several therapists in your area and whether they work online or in person. And you get a ton of information just from their website. So that is one way that you can find therapists to just start interviewing. And I would narrow it down and pick, maybe the top 3 that stand out to you, because you can tell even just from pictures and profiles, like, am I going to connect with them or not? And you can tell by the way that they write on their website, you get a sense of who they are. So I always say, take the time to do this process because this is a really critical decision. I mean, this is someone who's going to have a major influence on your thoughts and behaviors and growth and emotional support. And so you want to pick someone that's going to be the best person for you to accomplish what you need. And when you go on that 15 to 20-minute interview, bring in, here's what I'm dealing with, the things we talked about earlier to prepare, and here's what I'm hoping to accomplish, and ask them how they might be able to help you with that. And then I want you to sit with, this is the most important thing because our bodies have so much wisdom and our intuition is very connected to our bodies. I want you to take a moment after each interview and sit with, how does that feel in my body? Again, go back to, do I feel safe? Do I feel like they can help me? Do I feel like it's secure? And we might not always know right off the bat, but start with the person that you feel the most secure and connected with in those interviews. Don't base it on how good they sounded or the modalities they're using, because again, the research shows that the best success with therapy is the right fit and finding the person that you connect with the most. So all those things matter a lot. And it's really about finding the right person. And for us in the field, unfortunately, we can't get trained in everything because there's so many different ways to get trained. So we might not have that specific modality, but if we have the fit with you, then that's going to be the most successful therapy for you. And then after that process, actually, I want to go back to mentioning there's another site called heal.me, and they have a range of coaches on there as well that work with mental health issues. So here's going to be the main difference in case you're curious of the differences. So a therapist is going to basically help you focus on the blocks and trauma that needs to get worked through in the past to be able to function better in the present and will impact the future. Whereas a coach is going to be pulling you forward more towards the future that you want to create. And they may go back and unblock some of the things that are keeping you stuck, but they're not going to have the intricate training around trauma that the therapists have. So I think it really depends on your level of trauma in terms of whether or not to start with a therapist or coach. I am grateful to be trained in both because my work, especially as I've gotten trained in ketamine-assisted psychotherapy, is super focused on helping that client build their sense of self-worth and authenticity and create the future they want and be able to unblock some of the trauma in the history in the past that's keeping them stuck, which ideally you would be able to have both in one person, but it's not very common to find that. So think again about your goals, about what you're needing at this point in your life. And that's why I often tell people you might at some point need a therapist and then transition over to a coach, or you might be working with both at the same time. Or there are some people that are trained in both that can offer a little bit of both perspectives. But those are kind of your options in terms of, I would say exactly the same thing with the coaching. It's going to come down to fit, and it's going to come down to how comfortable you feel, how secure you feel with that person, whether they can help you. And it doesn't end here. I just want to let you know that sometimes we don't know if it's the right fit or not until we've worked with that person for a few sessions. And sometimes we've worked with them for a while and we start to need something different. And so it's something to constantly reevaluate because, again, this person that is in your life is a big influence on your life. And you want to keep evaluating, is this the right person for me right now? So some of the things to look for, and I'm going to say with both just after the first few sessions, do you feel like you can fully be your authentic self? Like this person is going to help you expand who you are and help to get you to some of those goals that you want to get to? Or do you feel like you're stuck a little bit in a box? And do you feel like they're keeping you in that box by some of the ways that they're interacting with you? And this is where I come back to therapists can only take you as far as they've gone. So there's a lot of therapists that have the theoretical training, but may not have done enough emotional work to take you where you need to go. So just be intuitive about that. If you've gone for a few sessions, it's just not feeling right, make a change. Don't hesitate to switch providers. And the same goes for working with someone for a long time. I recently worked with someone for a year and a half that provided great change in some of the areas that I was looking for. And then I just felt like I needed something different at this stage in my life. And so even though it's difficult to leave and say goodbye because you built a strong connection and there's a lot of attachment built in that, I think you need to see it as like this is part of the process, is honoring your needs at different points and making changes when it's appropriate to do so, and doing a healthy goodbye with each provider, because you're going to get something different from everyone. So I hope some of these thoughts will be helpful as you're trying to think about going to therapy, going to get some coaching, or going to even a psychiatrist. This is critically important as well. Find the providers that feel like the right people. Don't give up. Keep trying. If you feel like you've tried some people and you've gotten burned, just consider it like every other profession. There's some great mechanics and there's some really bad ones. And there's no difference in our field. There's some really, really amazing therapists and there's some really bad ones. And so you have to be discerning. Unfortunately, it's not the kind of thing you can ask your friends for advice around because you're the only one seeing them. So it requires you to trust your intuition and lean into that and just make decisions that are right for you. So hopefully this helps as you're navigating this process of finding support. And I hope that you're able to find the right person or people to help you on your mental health journey. I'll see you next week at Catalyst for Healing.